Long time no see. It's been what, a year and a half, 2 years maybe, since I've been on here, but I'm back with another surgery video. Since my last surgery video, which has been a very long time ago, I have dissolved all of my filler. So the filler from my chin, my cheeks and my lips. And obviously my nose is now fully healed, the lip lift is fully healed, but I'm now going to be taking you on a journey to my new boobs. My youngest baby is now a year old and I'm done having babies for a while. I want to start feeling a little bit better about myself, and I just cannot cope with these empty sacs hanging off my chest. So today is consultation day and I'm going to be bringing you guys along with me to Newton Le Willow's clinic with Pall Cosmetics. Just heading over to the Spalding station now, and then I've got a change from Spalding to Peterborough. Oh sorry, the change is Peterborough to Wakefield, so I'm going via Leeds, and I think the wait is about, I think it's like a 30-minute change over time, so I'm going to probably go and grab a coffee. The obligatory Waitrose stop in Peterborough station. Gonna have a little look in their bakery, see what I can grab for breakfast maybe. I don't feel hungry now, but I definitely will get peckish because I've got a long train ride on the next one, so going from Peterborough to Leeds next. Yeah, let's see what they've got. I actually cannot help myself. It's like, oh, you've got a day to yourself, so guilt literally overruns. This is literally the last age I'm going to be able to get them for Marnie. I'm like, I just want to literally dress her in them all the time. But how cute. Little PJs. Oh, I can't cope. Honestly, mum guilt. You can't just have a day to yourself without feeling the need to make up for it by getting bits for the kids. I've not really got much for boys, so I'm going to give it a no. But yeah, if you're thinking about becoming a mum, get used to not having any time to yourself without worrying about the kids. Can I get a vanilla latte? And can I get a almond croissant as well, please? To eat the Waitrose trip, feels really weird not grabbing alcohol. It's sort of like a norm to grab alcohol for the train, but I'm now heading to catch my Leeds train and then from Leeds to Newton Le Willow's. Just arrived at Wakefield Westgate, which is my next change to head to Leeds, ready to go from Leeds to Newton Le Willow's, and we are 41 minutes delayed. So I mean, currently at this moment in time, I'm stressed. I'm so stressed because my appointment is 12:40. It's currently 10:30 and I've got to wait 40 minutes for my train, and then I think the train itself is like an hour and a half. So yeah, I don't even know if I'm gonna make it on time. I think hopefully I've not just done like a 7-hour round trip for nothing. Literally got like everything going through my mind like right now, like sorted the kids for a full day, obviously booked my train. This was booked a month in advance, and now I don't even know. I don't know if I'm gonna make it. I'm hoping I am. Obviously I'm hoping I am. My heart's racing. I'm so nervous. Like, my anxiety is high right now because if I don't make this train, I'm not gonna make my appointment, and I know my surgeon is really booked, so pray for me. It's better because I got off at the wrong train, so now I'm heading to Leeds. But it turns out I didn't even need to get off at that train at Leeds. Yeah, I'm definitely late. I'm so late. I've messaged my patient coordinator, but she hasn't messaged back because she's probably busy with other customers and other patients. Well, yeah, I mean, at least I'm on another train. I need to get off here at Leeds, which originally would have been the train that I stayed on. And I got off because I was in a panic. But yeah, I'm going to get off at Leeds, then we're changing over to get over to Newton Le Willow's. But this literally reminds me why I don't do things like this. Like right now I'm currently in a croissants at Waitrose. It's your sign, because honestly, delicious. So good. We're off, and it is now Stampede to platform 16 for the last final train. It's the last time that I came here. I was training in Manchester. It was in January last year. And I had little Marnie in my tummy. I was going to my training course. This train station is huge, but platform 16. We're nearly there. I'm so out of breath. It's really bad. Things like this just go to show. I need to start training. Can't be a lazy bitch anymore. We get nowhere in life, especially when you've got to do things like this. I thought I was going to make it on time, but my Uber's here waiting. I'm going to be 5 minutes late, but I've already let my patient coordinator know. She said it's all good, it's all that panic, pretty much for nothing. But I do hate being late. I could literally give myself an hour spare, and thank God I did. But yeah, I feel a lot better now. My anxiety is definitely not as high as it was. I'm just excited to get there so that I know we're all sorted. I'm ready to meet my surgeon. Hello.
How are you?
Thank you for waiting.
You're alright, okay?
Yes, I'm good, thank you. How are you?
I'm good.
Good. I'm here. I'm just walking around to the entrance now, and it looks so nice. It looks a lot nicer than the first hospital that I came to when I went to Birmingham for my first breast surgery. I'm so excited now. I'm getting really, really excited. The fact that they've got like the whole hospital, this looks huge. Hiya, I had an appointment booked at 12:40.
What's the name?
It's under Becky. Dr Prasad. I think it's for a consultation. Yeah. Next door. Okay, thank you. Yeah. Yes, thank you. I had an appointment booked at 22. It's under Becky. Holloway. Thank you.
Yes, you do have excess skin on the breast. Yeah, so that has to go. Yeah. And that can only be removed by anchor shaped scar. Yeah. You know, cut around the nipple vertically down. So it's maybe something around 70-80% of what its size is. Yeah. Okay, so just do a few things. So in this front position, what I look at it, can I see any breast tissue below the nipple? No, I like them to be a little bit bigger so that you can see some breast tissue below the nipple, you know. And the next thing what I look at, put your hands up here now. In this position with the arms up, can I see the bra line? No. There is still some overhanging breast. And then put your hands down. And then also, if I put my hand behind the breast, you know, as far up as it goes, and try and match where my finger touches the back finger with the front finger, and that's where I would place your nipple to be. Right. You know what I'm trying to say? Yeah. And if I just look at carefully, both breasts are fairly equal in size. Maybe a tiny bit of difference could be there. You have got different sized implants as well, you were saying. Yeah. And I think they're always sisters, aren't they? Not twins, you know. You always find the breasts are a bit different. So, and I also feel, you know, this nipple is slightly lower compared to that one. And we will try and bring it at the same position, okay? It's just about sort of a couple of centimeters lower on the left side, not a lot. And I'm just doing basic measurements of what your sizes are on both sides. Yeah, slightly. You know, we would try one size bit. I was just giving you some size, you know, and then see how it is. Obviously, you know, there are a few things which will take you back to having uplift. Uplift will means I'm taking excess skin out and squeeze the breast into a smaller envelope. In that process, some people can lose half a cup. Some people having extremely saggy breast can even lose 1 cup.
Okay.
Our idea is to not to take any breast tissue out, but only remove the excess skin proportionately and squeeze them into a smaller envelope so that it gets firmer.
What size is this?
This you're adding another 2 centimeters, and then you are losing some because of the uplift effect. When you're standing, the gravity is down. When you're lying down, it works sideways.
Yeah.
Gel implants, silicone gel implants only. They come with a lifetime warranty, and
That is even one size bigger. Now tell me, how do you feel about it? But that's strikingly bigger. Cut off all the time. You know, you're welcome to try the.
It's so difficult to decide what's.
That's the thing.
Yeah.
So was everything as you expected in terms of what you said you needed and the information he's given you?
Yeah, I think so. I think like he's covered everything to do with surgery, and obviously like downtime, what to expect after. It's not my first time having breast surgery.
Yeah.
But I think that he's definitely gone over everything else and reminded me about
Yeah.
everything all over again. And also obviously discussed the result that I want to go for, which I think is the right one. It's
When was your
never
first
sure.
surgery?
It was about 5.5 years ago. So it's a long time. My breast had 2 baby cells. Unfortunately.
And how do you feel about having another procedure?
I would be on the table tomorrow if I could.
Really?
Yeah, definitely. But I'm not also in a mad rush. Like,
Yeah.
we literally just bought a new house. So it's like, I want to get everything in play and something booked.
Yeah.
But I'm also trying to be sensible.
When is
Consultation is all done. We've gone over everything and spoken about, obviously, like all the do's and don'ts post-surgery, what I'm going to go for. I'm thinking 625 cc. I'm beginning to quite quickly regret decided to walk. It's boiling. I've also gone the complete wrong way. I took the quickest route rather than like the main route, and it's just taken me through loads of little housing estates. But we're gonna get there. It's about 14 minutes left. So then hopefully by the time I get there, it's telling me I'm gonna be at the train station that I wanna be at 9 minutes past 2. My train's at 3 o'clock. Hopefully giving me some time to find something around the train station. It's the Manchester Victoria one, so I'm pretty sure if I remember rightly, there is a little cafe. It's so warm. I mean, I'm not complaining. And I could have jumped in an Uber. This is all my own fault because I was being impatient and I thought, oh, I'll just go for a little wander. It's not really a little wander when it's 27 degrees though, is it? Oh, this is quite nice. They send you an email. They'll send you a few emails once you've booked your consultation. Like recommendations of where to go and local places. And this was one of them. I'm going to make a fool of myself by saying this name, but Menez Park, I think it's called. It is so gorgeous here. Places like this where I'm like, oh, the kids would love it. The dog would love it here. Could have brought a little picnic, done some sunbathing, bought the football. Honestly, literally, like, the kids never slip your mind once you become a parent. Everything is them. My mother-in-law has been like sending me photos and videos and all this of them, and I miss them. I've got all day with them tomorrow before I'm back to work, but I miss my babies. I am looking forward to getting home. I haven't sweated this much since being in labour. Finally at Peterborough station, so I'm waiting 5 minutes for my train and then I'll be home. I get to see Craig and the babies. But thank you for coming along with me to my consultation day. There will be more to come. Let me know if you have any specific questions so that I can ask next time I'm there. And yeah, thanks for watching.